telehealth, what
Yes.
we would need is, I think, 3 or 4 really good case studies.
Right.
Drawing on, I think, some of the countries where working group members are in.
Mm-hmm.
And then I need to give a bit of thought as to, what is our angle? Because just presenting how telehealth was used likely isn't going to get accepted. Damien likes things that are novel. Like, and I want to know what we're doing that's different. How did the pandemic allow us to advance health informatics and telehealth in these low middle income countries? And what lesson learned do we have for going forward?
Right. Yeah. And I think that should be the focus of this paper, to say what stands out, isn't it?
Yeah. I'm going through the call because.
Yeah.
Yeah, I agree. I was just talking, Craig, that first of all, it has to be original research and not published elsewhere. And the second part of it is that I was thinking of brainstorming some thoughts. And one thought I was thinking about was informatics, including telehealth approaches to COVID in the experiences of our members. So how have people around the world used informatics to handle the COVID pandemic? Which I think is somewhat what you're saying.
Yeah, I think that's probably, I think, a pretty good way to look at it. And what I thought was interesting, like the call talked about, public health and clinical, right? So they're not just interested in telehealth for care delivery. And I think one of the things that we had talked about in both the last 2 working group papers was how telehealth enabled education, enabled people to get access to medications, just as a communication tool. And I think that could be an interesting angle too.
Mm-hmm. And in this context, we'd like to see how is it working out in a LMIC, a low middle income country setting, because there have been work done in the developed countries, but I don't think that is the focus here, isn't it?
No, this is strictly low-income countries.
Right. So that's something that we have to be mindful of when we start pitching our paper ideas.
Okay, but then we have to decide who's going to contribute, because I have done something here using text messaging to support citizens of Arizona for COVID, but obviously that's not of interest, and I have not done anything in developing countries as regards COVID. So which one of us has done it?
Well, there are 2 people in the group that have definitely been investing quite a bit of energy in developing country settings. I know that Gogia has done a fair bit of work.
Yes, I was just going to mention.
Yeah, in his work, and he has almost like a non-government organization that does this sort of stuff. So he might be one who can tell us something of a project that they're doing.
The Jamie bump doesn't say anything about developing countries.
Well, they said LMIC, the low middle income countries.
That's not listed. It's not one of the criteria for submission.
Oh, is it not?
Well, I thought it was.
Well, is it? I'm just reading it, but I didn't see anything about that. They're looking for original research and things that will help COVID for nurses. And specifically nurses was what really stood out. They're not looking for just telehealth, but looking at how nurses have benefited from it. But maybe I missed it somewhere.
No, it says manuscripts within the scope of this special include those addressing a range of topics associated with the advancement of the global health informatics research and applications for pandemic preparedness and response in LMICs. I think
I don't think I must be on the wrong link. I think.
You might have looked at the wrong. Yeah, it might be. There's probably more than one call at JMU.
I'm
Okay.
looking at the focus issue call for papers, global health informatics,
So,
and
No, I'm looking.
and I note that Najib and Magdala are both part of the editorial committee,
okay.
and so they're part of our group.
Right.
So topics of interest on lessons learned. There's LMIC driven in LMIC. Yeah, this does seem to be a lot of focus on LMIC. I agree. Yeah.
Yeah, but I think it's more than I mean, I think more than it's basically an LMIC focused theme. Like if you are going to do something on, say, the United States, then I don't think they're going to accept this paper. Is my understanding correct, Craig?
That's my understanding too. But Siram, I think where you can contribute is, I think the work you've done.
You're breaking up. The sound is awful.
Yeah, like Siram, I think where you can help is you've done work on telehealth in Arizona. Yeah, that's not a low middle income country, but I think possibly our focus could be, as someone said earlier, maybe if we did a very quick just review.
But guys, the sound is awful. The sound is awful. I cannot make out what you're saying.
Sorry.
Yeah, it has just gone a bit strange. Actually, it's only with serums. It's not with you guys.
I mean, I
Can you
suppose.
hear me now?
Maybe with me, but
Yeah, I can hear you well.
Hear you guys.
Siram, I think your voice is getting a bit jumbled. What you may want to do is to refresh, so you leave and come back, and then
Yeah, same to you. Your voices.
yeah, if you can refresh the browser, that might be useful
I
for
can
you.
leave and come back.
Yeah.
All right.
So.
Oh yeah, the thing I've got up is call for papers, theme issue, nursing informatics, and COVID-19. Are we looking at the same thing?
No, that's a different call.
That's the link that you sent, Aaron. So I'm just.
Oh, sorry. It's probably the wrong paper that's showing up here. Okay, let me.
Okay, if you resend that one,
I'll resend the thing that I have. The other one that I have. It's a Jamia call for papers.
Oh right. Okay, I'm concentrating on the wrong one. Yeah.
So isn't it a Jamia call for papers on global health informatics, isn't it? So let's see what we have. It's a Jamia call for papers for.
So are you saying that if we did one based on a low middle income country, that we can look at our learning, from our different countries on how it might support the delivery? So it'd be research in terms of. I'm not quite sure really. It's normally research is conducted. You have a defined process and protocol. Unless it's a vision paper, which I don't think they want that, do they?
So
Yeah.
I have stuck it in the chat. If you can take a look at the chat, you'll see.
No, it's not.
It's coming. It's going to come.
No, can't see anything.
It'll come in a bit. See if it has come now.
Yeah, got it. Yeah.
So that's what it says, that it is, the deadline is 1st June. Consider original research and applications, brief communications, perspectives, case reports, systematic review articles, manuscripts within the scope of this special issue include those addressing a range of topics.
Yeah.
Yeah. And in low and middle income countries, LMICs, as you can see. So they are very
some
specific.
low-income countries. And we know these models probably won't apply. They're going to be difficult to implement in LMICs. If we took a look at what's out there and then used maybe 3 or 4 case studies from working group members that would essentially try to look at what will work in existing telehealth models, but what do we need to do differently for telehealth to actually make a difference in LMICs. That might be a way we can do it.
Yeah, that's a great idea.
Yeah, I think so.
That's a terrific piece of thought. Something we can certainly put together, and then we can push it as a because we have that international experience, and we have that perspective both from a developing and developed countries like LMIC and HIC. However, maybe we want to look at it, and then we can blend those experiences to see what can work. Yeah. And also
So
additional
do we have
yeah.
the resources to do it? Like, I mean, Aaron, do you have any students who could help us collect the literature?
Yeah, I mean, I could source it. I've got I just got a guy who will probably be finishing.
Great.
Yeah. So we
It
could.
does say perspective. It says original research and briefing perspectives, case reports, and so there's quite a wide range of articles they're accepting.
Yes. Yes.
But yeah. Okay, but if we take case reports, there'll be because like, for instance, in England we've got there's a couple of things I do know about the pulmonary rehabilitation or virtual reality. We've got texting, but the thing is, there'll be other people doing it, and the only way to find out about it, what data they got, and then put it in. But whether they're doing research on it as well, I don't know. So we could find case studies of things being done or have been done during the COVID. Is that what you mean? Just find case studies of where telehealth has been used, and then we can write about it. So, yeah, I suppose, we just have to think about it and try and see if we can find good ones. For me, the virtual pulmonary rehabilitation would be quite a good one because it's pure telehealth. And I know the guy who owns that, and I know they're doing research on it, but they may be willing to sort of say how the process is, and then we can take the theory and the organisation, all the other things that go with it, and compare it, different types of telehealth delivery. Or we could look at one particular area like diabetes or respiratory, but that might be more difficult. Just think.
Yeah.
In Journal of American Informatics. So we can look at something like a long-term condition, if it's possible. But we may not have access to case reports of stuff from different countries.
Well, I mean, it talks about applications. So people have done something that's quite useful, or we can put together a systematic review for that matter, if that is of any interest. So put together what people have done across, and then what people have published, and then
look at the challenges, like where it fits and where it doesn't fit, and then our contribution is how we can better apply these in LMICs.
Yes. Yeah. So that's a piece of thought that goes with there. So you could say that, and it's kind of in line with what we've been doing for the last few issues of the yearbook as well. That we've been taking our experiences and then we are crafting a response pattern that we are showing. Say, for example, in terms of some of the problems that we have faced this year, we talked about some of these issues. Something on the same lines, we could do that.
Yeah.
Yeah, because it's still worthwhile to see who's doing what in LMICs, and because we have that group, we might as well might as well convene a round table to see who has done what and what kind of things that they have faced, and then we could
And what results they achieve.
yes, and what are the lessons that they have learned and things like that. That could probably fit well into this scheme, isn't it?
Yeah, I think so. I think it will fit nicely. So, I mean, we could start. So, I think the first thing, Arvind, is if you could get your student to, search and give us like 5 to 6 cases we can review. I guess we can ask Shashi right away and see what he is. Ask him to present what he has done, right?
Yeah, but I think, yeah, we could do that, certainly. But because we already have a group in which there are people from LMICs who may be doing work that may or may not be much vocal in the group, we can probably issue a call to see who's doing what kind of work, and then let them talk about it, and then maybe we can source the case studies from there right away, and then we can start.
Exactly. Yeah, that's great. Yeah, I just wanted to make sure we don't miss something. Yeah, but I think that's great. Yeah, just I know Shashi. What is that other guy? There's another guy, Jai something. But I know these people in India. How about other places? Is anyone? I'm not sure what people are doing. I guess we can ask Magdala what's happening in Brazil.
Well, the papers that were published already, there's a number of quotes. And Brazil, they had this text reaching over 100 million people.
Yeah.
Right.
And they did a mapping thing as well. And so there's already some bits suggesting that there was some pretty good stuff happening at scale. These are examples of scale. And then you link it with the systematic approach by the country of how they're supporting. We've got to keep it fairly simple, though. It's all over the place.
So where do we go from here? What would Craig, Vijay, Wouter, Suram, would you say that we do as the next step?
Yeah, just reach out to our members in LMICs, Shashi, Uday, Magdala, and Najib, I suppose, and ask them, well, do you know what has been done with respect to informatics telehealth for COVID in your countries? Get that information, have your student collate all that information, and we should review that and see how to put it all together. We might be able to discover commonalities and differences in the approaches and relate that to local conditions.
Okay.
Yeah.
Make sense?
Yeah, does actually. I mean, that would be because the time is limited, so we need something fairly quick. But the other thing was that I think various countries, so I noticed in India they got it, and I think Brazil and New Zealand, they each got, because we're working on the telehealth guidance program. We've also got the national programs in the UK, and this is not low middle income countries. That's the other approach, that you could actually take what the guidelines are for delivery of, obviously we're focused on telehealth, but they're looking at global health informatics.
Okay.
And you could bring those together as well. That'd be another approach, but it would have to be in the low middle income countries. The systematic review would probably be more specific to low-middle countries because the article will be as well. I think the others may be more applicable generally to non-middle, low-middle income countries.
Yeah, for the CIS review, I would actually go broader because I think we'll find more telehealth models and frameworks just for general. I think if we could find what's out there, take a look at it, then look at the case studies and pull out, I don't know, 5 or 6 themes that really are relevant, more specific to LMICs, I think that becomes our contribution. What's unique about LMICs that just isn't represented in the current state of the science of telehealth?
Yeah. So there are two pieces.
That'd be really good.
That'd be really useful because then there are 2 pieces of work that will go hand in glove. One is the CIS review that we'll be putting together, and then you have all the case studies that are filling into there to say that, look, this is what we found in the literature. This is what we find in real practice, and see how they're mapping and matching with each other, isn't it?
And we've done the second part more or less in the various papers we've already published.
Yes.
So we could actually do that fairly smartish if we get the systematic review. And I like the idea of maybe, actually you forget sometimes, what is the difference between low-middle income countries and people and countries who are not? What's the stark difference? Obviously that becomes like access, technology and emphasis, but that's part and parcel of what should be a fairly interesting discussion point. Not quite sure where you start with this.
Yes.
Systematic review is the first one.
Well, got to be careful. A systematic review is a very specific object which answers a specific question. And I think it may be, I think that is really another level of difficulty, but more like a scoping review and review of interventions is better because systematic reviews are actually very difficult.
I see what you mean. Yeah, that's right. I mean, okay. So, call it
I
as.
agree. I think a scoping review is actually more suitable, and I think given that we'll have, let's say, 3 or 4 case studies to go with the model, I think this will probably be better framed as a case study than a review article.
Case studies are how should I put it? A summary of case studies.
Yeah.
Because we're looking at 4 or 5 different cases, I hope, in different countries, different LMICs.
Okay.
Yeah. So I think that's the way to go.
Okay. So, well, if you're agreeing on this, then maybe one of us should take the leadership in posting this idea to the group, and then we go with it. Who'd like to do that? Craig or Saram, you guys can coordinate and then maybe float a call for, I don't know how you want to do that, but would you guys like to shape up something?
So I'll just send a quick email to the group and say that this is an opportunity to write a paper. We discussed it and we suggested that this would be an appropriate paper. So please share the work that you know of whether in LMICs with regards to informatics, telehealth in the COVID pandemic. How about that?
Yeah.
Well, the other thing is this doesn't mention the COVID.
It doesn't, but COVID seems to be the most relevant.
It does mention pandemic.
Yes.
Okay. I've only got this summary here.
So see, one specific topic that they say is the first one, innovative health approaches solutions to address COVID in LMICs. So yeah, I agree with you, Vijay. It doesn't specifically have to be, this is not a COVID focused issue. And if you can find some other stuff like, I don't know, non-communicable diseases, that also
it's fine. I've seen it. It's just pandemic preparedness, which is.
Right.
So does that mean that the case studies can only be from? I mean, from because when you send this out to the group, that's quite a broad thing you just said. I mean, it's a
Okay.
broad, and they may not know where to start because we've had the conversation. The ask from the group is got to be fairly clearly defined.
Yeah, and then share the link of the call for papers. I'll see if I can
Yeah,
find
I
it.
can do it. That's
Yeah, okay.
easy enough.
So if you can do that, then
Vijay, if you want to sharpen my note to everyone, please feel free to email me. You have my email and give me your suggestions. Otherwise, I'm going to be trying to sending this in the next couple of days.
Yeah.
So because from April 4th to 14th, I will be in Bangalore, and as I said, and I'll be dealing with some family stuff, so may not be very easy to communicate with.
I think with time, well, let's just send the email out now, and because with the link, if you send the link of this thing, it'll be quite clear to them anyway in their thought process.
Right.
We need to start the conversation, the Google, what is it, the Google
groups
conversation. Yeah, something like that. So we can, once that starts, it's fairly clear which way we go, I think.
Yeah.
Yeah, that sounds pretty good. No, I think we just send it out. The sooner the better, actually, to get the thought process going. And then we can just regroup, I suppose. But no, it sounds good. It sounds fascinating, actually, if we can get something out of this.
And Jamia is Go ahead.
I think it's a good opportunity.
Yeah, it's a very good opportunity. It's an excellent opportunity, to be honest. I mean, it's you do get citation in a top tier journal, which is not easy to get, and there is no publication charge, isn't it?
No publication charges, yes.
Because it's with Jamia you don't have to pay the publication fees and things like that. So it's quite important.
Yeah, you only pay if you want open source.
Right. But anyway, that can be, we'll see. We'll cross a river when we come to it.
Yeah, Jamia is regarded as a very good journal.
Yeah, it's
I think I have one or two papers that were long time ago.
Okay. All right, so we have a way now going forward, isn't it?
Good.
Yeah. So thank you, Craig, Vijay, and Sriram. So we have a way going forward, and so the action point is that.
So I will send out the email in a couple of days.
Yeah.
Lovely.
Sounds good.
Great.
All right then.
Okay.
Nice meeting everyone. Thanks, Aaron.
No. We are not done yet because Wouter is going to do his presentation on the guidelines.
Oh, I'm so sorry. Sorry, Wouter.
I unfortunately have to leave because I've got another meeting. But
Okay,
I will,
no worries.
I'll follow up. I look forward to kind of working with everybody on the paper.
Okay, fantastic. That'd be good. Yeah, thanks, Craig.
Carol.
Yeah.
Craig.
Yeah. So Wouter, over to you. Can you hear us?
Yes, I hear you.
So Wouter, can you please share your screen and walk us through the work that you have done and the plan that you're going forward?
Yes. Do you see the screen?
Not yet, but I think we should be able to see that. Vijay did a very quick round about to see. Can you see? It's probably come up, but have you put it up on the screen?
Yes, I have done share screening, and this is my screen. So.
Okay. So maybe if you click on share one more time, it'll go away and then you start again to see. So it's like.
Okay, I do it once again.
Yeah, so click on that share button and then share screen. Because you did last time.
I have done so. I will do it again.
Yeah, so you did it last time, so it should work. Oh, he went away and then he's going to come back and join in. Yeah, this thing probably will need some kind of maybe a workshop on how to use this medium. What do you guys think? Or shall we go back to Zoom? Wouter is back here again. That's good. Wouter.
Okay.
In my opinion, I think we should go back.
I'm back here. Do you hear me now?
Yeah, I can hear you well. So if you click on that, if you click on share, you should be able to share it.
I am sharing screen now. Do you see my screen?
No.
No.
No, we can't see your screen at all, Booter.
No, I cannot see.
Well, let's do it
I
like
also have
this.
to take off in about 20 minutes at noon.
Yeah, no, let's without wasting time, let me put up the PDF document up so that people can read them while you are working on your while you are guiding us through. And we should be able to see that. So you guys should be able to see that thing. Can you not see that?
No.
Oh, yeah. Got it. Yeah. I'll just have to get a bit closer.
I guess I have to rotate myself to see it. There I see it. I have to come closer to it.
If you guys move back a little bit, then you should be able to see the screen.
I don't know if I'm behind it or not. I'll go forwards.
The document seems to be written right to left, from my point of view.
Okay, so which means that you're behind the document.
Exactly.
Yeah, I don't know how to. I can't get forwards.
Where am I?
You can use the arrow keys to move around, of course, if you wanted. Move back a little bit and see where.
Alan is in front of it.
Okay, so Wouter, you may continue and tell us.
Yeah, why don't we just stop?
Yes. Okay. So can I start?
Yes, please.
Please.
Okay. Well, this is an update of the telehealth guidance program. So 2 weeks ago, I have given an overview. So I would like to focus on a few things. These are the line of activities that are in the plan of action. So the first thing is to fill the website with existing documents that are separate. They don't have to be aligned. And so like national regulation documents. And they're, that has priorities. So the website is being built now, and we are now connecting it to Zotero for a database and a repository. And well, next week, I expect that I can give you more information about this. But that's about what I would say about this. So if you have any questions, then the second thing is develop specific guides. We have had a survey. Alan has monitored the interests, and I have given the update on the so 2 weeks ago. In fact, we had planned to start that now, but we cannot do everything at a time. And we are now focusing on the third point, which is also part of the action plan, a framework for consistency and coherence across the individual guides. And that is because my manuscript that I had submitted for the book that so Christina Higa had shared a call for chapters with it for a book named Telemedicine Systems for Unreached Communities. And I had submitted a chapter, how to implement ISO IC standard for telehealth service and mobile medical apps. And about 2 weeks ago, I learned that it has been accepted. And so I'm working at it now. The deadline would have been 10 April 1st, but 2 days ago I heard that it was 10 June. So that's a relief. The subject of this is really the same as the framework for consistency and coherence. So my suggestion is that we do this first, and then we have a common framework, common grounds for specific guides. Well, that's what I would prefer. And the chapter that I'm now working on contains a model for telehealth management in line with the ISO standard on quality management services, quality management systems, and ISO 13131 on telehealth. So we end an explanation of the model and how to use it, and this also means an introduction to ISO 13131. That could provide a basis for the specific guides, and perhaps this could be an official document of the telehealth working group, because it provides a basis for the whole program. And the model, I have showed it 2 weeks ago, so I will not go into details, but it is a table, and these are the clauses, the important clauses of ISO 9001. This is the what's called the health, no, the structure of the high. That's how it's called. Sorry, high level structure. It is high level because it is quite at an abstract level, but this is really these columns, these 6 columns, and well, it's quite. It's actually a matter of common sense. First, you have to know what the scope is and the context. Then leadership is where are we going to and why do we do that? Then you make a plan. Then you care for support and resources, and then you do it, and then you evaluate it and you improve. It's as simple as that. And there are 2 domains for us. The first is patient and family for telehealth services. This is what the telehealth services are about. And here the operations, patient and family, here are the telehealth services, care delivery and self-care, leading to patient outcomes, and you can also use process indicators. Well, quality management is the middle bar, that's in yellow, and here is well, that's how you manage the quality, and this is really ISO 13131. And you see that that's in the middle, and it sort of guides, it governs the patient and family processes, and also actually the population level. I will come to that. But it's very simple, really. You define your policy, you make a plan, you manage the resources, and then you have quality procedures and protocols for telehealth service, and then you evaluate the whole thing, and you adjust your quality management system. This is quality management system. And well, the population level is like the national or regional level. Here's the national policy and national regulations. First you look at needs and demands, standard health and regulation, healthcare system, healthcare plan. You care, so at the national or regional level, you have to take care of infrastructure, workforce, technology, ICT systems, financial system of healthcare. And then you have to ask, did we really reach equal access? That is a question that has been addressed in the yearbook. And then you evaluate the impact on health and equality and also financial aspect. Well, this whole scheme aims at being a comprehensive scheme for the guidance project program. So I don't know if you have any questions about this or any feedback.
Oh, there are only 2 pages here, wasn't it? This one here was
Sorry?
your plan. So Wouter, it had only 2 pages. So you have the proposal here and the model here, isn't it?
Yes.
So
yes.
this is the model that you want to implement, yeah?
This is that's right.
And this is your propositors.
I don't have other pages.
Okay,
Yes.
that's fine. That's what I wanted to do. Okay. So you're going to put a survey to the group, isn't it?
Yes. So what I intend to do is write a proposal or a first draft of the chapter, which explains this, which presents this model, explains it, and so there will be a text in the chapter that reflects the basis of our work in the guidance program. So the next step is that I think I need 3 weeks or so to make the first draft, and then I could send that to the group, and then we will see. I think that it would be nice if we have a text in the chapter that serves as a sort of one might say a position paper or something like that. How do you think about that? Such a purpose?
Yeah, I think it's a very good idea because you're sending something you're putting it up as a book chapter as well that people can use when doing things. But you also mentioned a survey that you wanted to send out to the members of the group, or did I not understand it correctly?
Oh, sir, I'm afraid that I did not make myself clear. Here, this has been done, this survey,
Okay.
Ellen has sent a questionnaire on the interests of the members of our group, and that has been answered, and I have reported on that 2 weeks ago.
Oh, okay. That's good then.
And so those guides. So my idea is that if we have more common grounds, or a common framework like this, then we can start the specific guides.
Okay.
Because then you can refer to the same overall model. For instance, if we look at let's say teleconsultation, that is a telehealth service, so that's right here.
Okay.
You need procedures for this and protocols, so more clinical protocols and clinical quality procedure. You look at the outcomes, but you need conditions. Conditions are that you have a care team, that you have an information architecture, you have technology, hardware and software, and finance. And that has also its conditions, that is that there is a care team with roles and responsibilities and a patient care plan. And the care team consists of the patient, family carers, and healthcare professionals and others, and to have to respect the values of the patient and family in terms of health, autonomy, choice, privacy, and others. So this could be a sort of framework for teleconsultation.
Okay, good.
And there are also other.
Yeah.
If you look at national, regional plans, they should result into an infrastructure for equal access and impact on health quality. And these are horizontal connections, but there are also vertical connections, like you do need a national infrastructure of, let's say, ICT systems to be able to exchange information using ICT. Well, that's it's sort of trivial, but that's this column connects the national policy, let's say, to what happens to the individual patient. And that is, well, in quality management, that's called resource management. And it is the clause in ISO 9001 called support. Support is about resource management.
Yeah, no, thank you very much for that.
So this is...
Yeah, no, that's understandable. So Vijay had a question for you, Wouter.
I'm going to depart, so sorry, Wouter.
Yeah, okay.
I have to.
So thanks for coming, Sriram.
Excuse
Oh,
me,
yeah, of course, sir.
Yeah, is that okay? The question I have is that I did ISO 9001 2008 for my practice for 17 years, and there's a whole load of checklists that we went through with a quality manual and processes for each of the people in the organization, and we were assessed externally once a year. It's like trying to solve telehealth, and a lot of it, some of it's relating specifically to technology, some to telehealth, but some is generic across processes in general to ensure safety, quality, effectiveness, and the health reasons. So is there, I mean, I was going to get I didn't actually download it. I was going to get the ISO 13131, but it does require a checklist, and then it's whether each country, each representative will then work out whether there's something in the documentation which covers the checklist. I'm just wondering about what you feel is going to be, how this is going to work, I think, in practice. And one good way of doing this is to have one small area that you can give an example of how it would cover this. But I get the feeling you've done this already, so it would be a matter of taking the kind of process you've done and just making sure we articulate things you need to consider in delivering a guideline. I'm not sure what your thoughts are. And I'm working with NICE, so we've got a whole guideline program which is split up into various sections, and each section they have to cover a certain number of things, engaging with the public, making sure, so the program of work that's involved in setting up a guidance program is very thorough. So I'm just wondering what your thoughts are about how you feel this might practically move forwards. And you mentioned going to the other members, but it could be quite overwhelming, the whole number of things you have to consider, unless you want us to just think about certain areas only. But I think it's really good if we can get this done. I'm just wondering what your thoughts were at this point in time, Wouter. I hope you heard that.
Yeah. Could you please summarize your question and perhaps speak a little louder? My computer
this is mine's a bit faint as well. So the point is, there's a checklist of things one has to do to meet the requirements of a total quality management system. And are we going to follow a checklist? I suppose that's my question, based on the ISO 13131. That's kind of the question, I suppose, as a summary.
Yes. If you understand right, your question is about the implementation of ISO 131. Is that correct?
Well, this guidance program is based on ISO 13131, and so I presume it's translating 13131 into this guidance program. In that case, we can't ignore the requirements of the ISO requirements. Is that right?
Well, actually, the ISO standards are only a part of the program, really. And it is my personal interest, really. But I do think that the scope of ISO 9001 is so wide that it really covers our program, because ISO 9001 is about quality management. Now, and what is quality? Quality means that you meet the needs and expectations of your customer, and that is a patient. Well, that is what healthcare is about. So, talking about the scope, I would say, well, indeed, ISO 9001, in my opinion, defines the scope of the program, or really, of course, it is possible that we find, well, we come to a subject that cannot be positioned in this model, and then I will not say that it is not relevant. Then we should perhaps adapt the model, or say, okay, now we have another thing that does not fit into the model, but we do not reject it or so. Is it an answer to your question?
No, I wasn't talking about ISO 9001 because I've done that. It's more about the ISO 13131. That's the telehealth.
Oh, yeah.
That's what
Yes,
that going to be translated into this program.
I understand. Well, in my opinion, ISO 131, so the scope of ISO 131 is literally quality planning of telehealth services. Now,
Yeah.
what is quality planning? I looked at definitions, but also at the standard itself. And it is very much about resource management also, workforce, ICT systems, technology, and finance. But it's also about about the other aspects. They are all dealt with in the different parts of the standard. So I have looked very critical. I've been trying to look very critically at which parts are not covered in the standard, and well, not everything has been made explicit, but I do think that it covers very much of this model, and I cannot answer that question definitively now. I think it's also a purpose of the chapter that I'm working on and would like to share with you, to well, sort of to answer the question that you have now posed. It's a well, it is a very appropriate question. So I think it is a question, a sort of research question, in the chapter. Is that an answer to you, Thwg?
Mm-hmm. Yeah, it does actually. So, just one more thing. So, when the group are going to be approaching this, is it going to be relevant to 13131? Is it going to be aligned to it, or are we just going to look at what our processes are outside 131? Because I'm used to working to a standard. And I think where we start now is how we're going to be starting to think. And as I said, I think I probably will get the 131 standard so I can read it myself. But it's what the overall objective, the end point. So if we start it now, in 2 years' time, if we make good progress, what will that look like? What have we done? And this slide you got is really good because it gives us the approach where we want to end up, but I just want to get my thinking right so I can, if I'm looking at say UK or Europe, what I'm going to find, I can then search for the right kind of material to inform this process.
Yes, well, I think the starting point, there are two starting points. That is this model, and that's sort of my my specific interest. Yeah. And well, for instance, ISO 131 focuses on quality characteristics, quality plan, research management, quality. So it is this line. Now, of course, there are specific interests in, well, let's say, equal access to healthcare, for instance, or the patient and values of the patient. And that has to be worked out. And sources for the information. And well, I don't know if I have made myself clear.
No, it's great. I think this is great actually, because this is the conversation that I like. So basically, because I'm sure the telehealth guidance will cover. I think when I did the ISO 9001, there's things open to interpretation. So when the assessment come, it's a kind of the words and the sentences are very clear, but also non-specific. So you can interpret it. So I think access would always be something that is in quality and care anyway. Values of patients is always going to be there, whatever we do, even though it's not stated directly. Indirectly, that makes an expectation. So what I'll be looking at in my country, in the UK, is looking at what approaches we're using, say, for the quality management, how we're approaching that in delivery of digital healthcare, and then see how it applies to the telehealth as well, and how it would match this. But from what I gather from what you're just saying, then the 131 is one thread, and there are other aspects not covered so specifically. And my question is, how are we going to address the 131 aspect, or do we not have to worry about it? I just want to make sure, can I exclude 131 as a... Because if you do 131, you have to go into detail with it. If we don't do it, then that's fine. We have to just maybe get aspects of it which are relevant to our conversation. So my question is, are we going to meet the requirements of the standard, or are we just going to look at parts of the standard relevant to where our focus is on the guidance program?
Sorry, could you repeat your question so I can answer?
The focus is, are we going to be... You're right about the two strands. There's the 131 and there's the specific interest, so you could call it that. So with the 131 section, are we going to, in our guidance program, are we going to try and meet that standard completely 100%, try and address that as a guidance, or are we just going to look at sections of it in terms of what's relevant to what we want as a group to cover these areas you've put on the slide? So are we going to have to know 131 inside out, basically, as we go through this program, or not?
Oh, I see. No, I don't think we should. That each member of the group should be familiar with all the details of ISO 131. No.
Okay.
On the contrary, I think that our work could and should contribute to a review and possibly revision of ISO 13131. And so there are people in our group who know that standard. Alan Taylor was the editor, and I've contributed, and Jay Ganesh did so, and others did not. But that's not important. I mean, it's not necessary. On the contrary, I think it is very sort of refreshing to have input from people in the group who are not acquainted with ISO 13131, and that is going to be a dialogue within our group. Is that a question? Is an answer to your question?
That's much better. Now I've got it. Sorry, that's really good. Yeah, that's going to be quite... Yeah, so so you want to inform... so you want the group to inform on areas that maybe not addressed in the standard.
Yes, sure.
Clear, that's a lot clearer, yeah. And I think we leave it to you. You're going to look for what you and Alan Taylor and Jay know about it. There'll be some areas you think we should explore.
And so our contribution, specific contribution, would be to give input and knowledge about this standard. But other members have knowledge, specific knowledge about other aspects, and we communicate and collaborate to sort of integrate this our knowledge for making standards and or guides. And these guides are sort of independent of ISO 13131, but of course they could and should refer to that standard, but also to other standards. And we could also give feedback to the ISO community on what we have found and give recommendations on the further development of the ISO standards. So is this an answer to your question?
Absolutely. Really
Okay,
good.
fine.
Really good. Thank you.
Okay. And as for me personally, I find it very stimulating to collaborate with people who are not so familiar with standardization, because in a way standardization can also sort of narrow your mind, you know.
Yeah.
Because then you think that everything can be put into a formal structure and so forth. And we know that reality is not like that. But I think it is the dialogue between people with different ways of looking at it that can be so useful and productive.
Yeah, no, that's really helpful. And just let you know that I'm on the NICE committee, so we're looking. I mean, they look at guidelines and standardization, but what they've realised, well, I think it's becoming realisation, is that the evidence that you're using, which is the principle, we have to take it very carefully because evidence doesn't always relate to practice. So when you're looking at personalisation, the research evidence and the committee, conclusions may not relate to what you're doing. So we have to think in a different way. And this is the new world, I think, in some respects, that we're more clear about real world delivery. And that sits very well with me. That's really good. Thank you, Wouter. Very good.
Yes, and as to me, I hope, as far as I know myself, that I'm open to other views and things which I've never thought about and so forth. So this purpose of the scheme is not to be limitative or so. It is a starting point and a way of looking at things. And perhaps after 2 months, we do think that it has to be adapted and perfect.
Yeah, I think it'd be good. So the rest of the group, it'd be good somehow to simply articulate that. I think that what you just said is very straightforward, actually. So it's it gives a vision of where we start now, and that integrates very nicely how we're going to approach this this journey. Because I think everybody needs to be on the same page in some respects. No, that's great, Wouter. Very happy.
Great.
Okay, great. Thanks for your comment.
Yeah, no, that's fantastic. I think we'll have to wrap up the discussion today, I'm afraid, and we will continue it on a group. So we had, so we'll get back to the group, and then we can.
I mean, how are we going to report to the group about this discussion?
Well, I have already video recorded it, so I will be sharing the video to the rest of the group, and then if you want, you can lead a conversation, perhaps writing a post about the points that you wanted to make, and inviting comments and the next steps. That could be one way. What do you think?
Yes, would it be an idea that I write a draft note about the discussion that we just had, and send it to the 4 people who were here, so we make a collaborative paper, or not really paper, but a note on what we have discussed and what our views are. Is that
I think that's an excellent.
Could I send to you so we?
Sure. Excellent
idea. It makes much more sense than. just one opinion. Okay, thanks.
Yeah.
I will
Yeah,
do so.
please do that. And
Excellent.
yeah, and I will leave this PDF document in this space. So if anyone wants to come and take a look at it, they can come and take a look at it in this space. Thanks, Vijay.
Yeah, that's really good.
Yeah, you're really good at it, aren't you?
No, I just spotted it. We need to. There's no way of doing applause, but it's really nice. This.
Yeah, let's do this. I'm going to leave this graphic up here in this space. So Wouter, if you want to direct anyone to come and take a look at it, they can do it. So people can, if there's any other document that you want to park here, you can do the same thing as well. So that way you can direct people to come and visit a website where they can read almost like a library of documents that you want them to read and take down. Would that work for you?
Yes. You mean is this about this Eventbrite?
No. The Eventbrite is to
sorry.
organize this, but this space, like the hubs.mozilla.com, here, for example, it's a three-dimensional space where you can put in as many documents that you like, almost like a gallery that people can come and read through and browse through. We can use that space like that. It'll become clearer as you start using it more.
Yeah. Sorry.
Yeah. Okay. Think of it like.
Yeah, there was a technical problem. I didn't quite hear what.
Okay,
But I would. So Ellen and I have suggested that we use Trello as a project tool, and
Okay.
we will soon. How do you say that? Introduce that into the
Sure.
group.
Go ahead.
And personally, I would prefer to use Trello because it connects tasks to documents, and it is
Yeah.
it is more functions, you
Yeah.
know, than this.
I know.
It makes very clear what
Mhm.
which piece of work are we doing, and which documents are connected to that piece of work
Yeah.
within the several projects.
Yeah.
So if you agree,
Yeah, go ahead. And
we
I
will
use Trello all the time.
for the storage and.
Yeah. I use Trello all the time, so go ahead and use that. I think it's a very
Okay,
good
fine.
way to. Yeah. Fantastic. I think.
Okay, fine.
Yeah, good to have a great chat today, and we'll catch up again. So thanks a million for coming over, Vijay. Great evening, and
It's been good. Looking forward to the journey, Wouter.
yeah, it's a great presentation, Wouter. So and good project. So look forward to it.
Great.
Okay, thanks
Great.
for your feedback.
Fantastic.
Wonderful. Take care.
See ya. Bye
Bye then. Bye.
bye. Sure. Bye.
Okay, bye.
See ya. Bye bye.
Bye.